All right, so you are in the session. Welcome to the session, Storytelling with Data, Preventing Suicide. This story is by Franciscan Health in partnership with the BroadStreet Data Co-op. And the speakers today are myself, Tracy Flood. I'm the CEO and co-founder of BroadStreet, and Tina Hoffmann, the Community Health Improvement Coordinator at Franciscan Health. I'll let Tina tell a little bit about herself and Franciscan.
Hi, y'all. Good afternoon. As Tracy was saying, my name is Tina Hoffmann. I work for Franciscan Health here in Indiana as a Community Health Improvement Coordinator. My job out within our community is finding all the good resources and all the good organizations that are doing the work and kind of trying to bring everyone together to the table to work towards our goals together. We work on things like using correct language when we're talking about even suicide or trauma. We work on collective goals together. Our Franciscan Health, we're so excited to be with BroadStreet, especially in this story that is difficult for some of you. And we wanted to bring a story about hope. So I hope you like it. We're so excited for it.
Thanks so much, Tina. And I'll introduce Brenna and Sofia, and as well as BroadStreet. So BroadStreet Data Co-op, if you don't know about us yet, is a data engine and software platform. And we're really founded on this idea that good data heals the world. We really believe that data has a role to play. It's not everything, but it definitely is something. And that's why we believe that everyone working to improve community health deserves access to the best information possible. We also really love working with Franciscan. The suicide prevention story is our fourth story working with Franciscan. And we really admire their boots on the ground approach, working with key stakeholders in the community. And we really value that partnership because we take data and put it into context of those with boots on the ground. So I want to now introduce Brenna and Sofia, who are the authors. And I'll let Brenna tell a little bit about herself.
Hi, everyone. It's super nice to have all of you here today. Thank you so much for joining. My name is Brenna, as Tracy said, and I am located a little bit outside of Minneapolis, Minnesota. I got my master's of public health from the University of Minnesota, and a little fun fact, I guess, maybe not fun, more just like fun for me. It's really cold in Minnesota today, like in the 50s. And so I put a little fall background to sort of bring some of that like nice fall energy to the room because it's still very green outside, just cold. And I will pass it along to Sofia now.
Hi, everyone. Thank you so much, Brenna. My name is Sofia. Thank you so much for being here today. We're very excited about this story. I'm from San Juan, Puerto Rico. I got my MPH from George Washington University. And just like Brenna, I absolutely love fall. We sadly don't have fall here, but celebrating in spirit. So thank you so much. Back to Tracy.
Thanks so much. And I'm so glad that Sofia could join us today. As many of you know, Puerto Rico has been experiencing many storms. And for those that are in the path of the storm, now our thoughts are with you. So we're very glad Sofia could join us today. All right, so Sofia and Brenna have done an excellent job working and collaborating with Tina and the team at Franciscan. And I just want to give also a shout out to Kalama Kalema Hoyhoy Porter and to James Walters, who did the data work as well. So this is definitely a team effort. Yeah, we're excited to show you what we've got. All right, so the outline for today is that part one is going to be preventing suicide, a little bit of background about the story. We've already told you a little bit about us, and we'll go a little bit more into the Franciscan and BroadStreet collaboration. Then I want to talk about the preventing suicide story, the framework of how BroadStreet tells stories with data, how Franciscan works in the community to make a real world impact, and how the preventing suicide story brought all of those pieces together. After that, the second part is going to be a live tour. That's when we're going to be showing the basics of BroadStreet for those that have never been on the BroadStreet site before, and showing how to run a custom report for your region. The third part is going to be centered around questions and answers. And because this is such a cool group and we've already gotten suggestions for additional resources. We also wanted to set aside some time at the end for participants to share resources with one another. And we'll have more information about how to do that at the end. All right, so a little bit about the Preventing Suicide Story collaboration and the collaboration with BroadStreet and Franciscan. So BroadStreet is a data engine and a software platform, and we really love empowering those who are working to improve community health, which is of course why we love working with Franciscan, who has boots on the ground. And Franciscan is a health system located in Indiana and northeastern Illinois. And in each and every one of the communities that have a Franciscan hospital, they've been working within the community for the last 100 years, making those really genuine and authentic connections with governmental public health and with community stakeholders and key partners. And we really just admire the work of Franciscan and genuinely hope that the partnership is brought together in the Preventing Suicide Story. Now I'm going to talk a little bit about the BroadStreet side and how we like to tell stories with data. This is basically our approach. We do approach all community and public health opportunities from the lens of social determinants of health. We really do believe that the individual, of course, is part of this socio-ecological model. So that means that in the home and in relationships, people are living in the context of their community and even beyond in their society and the policies that overlay. So we try to frame everything in the context of social determinants. We do lean on the framework of the County Health Rankings and Roadmaps model by the University of Wisconsin Population Health Institute. We think that it's really nice the way they lay out different health factors and see how things cascade towards policies and programs to different health factors like the physical environment, the social and economic factors that make up somebody's life and neighborhood, as well as clinical care and also health behaviors. All of those converge on that central theme and indicator of health outcomes. And for County Health Rankings looks at length of life and quality of life. For us, we use this framework for different health topics, the health outcome, for instance, of preventing suicide in the context of those health factors and policies and programs. For the health factors, we do like to consider the different dimensions, like the physical environment, social and economic factors, clinical care, and health behaviors. When we approach a story, we start with that central indicator, and for this, it's suicide. We look at different rates and how they compare to benchmarks from the state and also the nation, and also whether or not there's trends going up or down over time. If data are available that show disparities by either age, sex and gender, or race and ethnicity, we do like to make sure that we're reporting the health outcome by those different demographics. In this particular story, we also took a special lens and to highlight youth suicide, and we also look at adult suicide separately. So we look at them together and also separately. We also do a little bit of a methods intro in regards to deaths from firearms. We believe that methods of suicide can be very illuminating as far as possible solutions moving forward. So that's relating to the health outcome. We then look upstream at the physical environment, for instance, if somebody's in a rural community and whether or not there's social and economic factors that may play a role, such as male gender and different age groups, economic factors like unemployment as well. Access to clinical care is really critical in regards to this issue, and we look at different indicators around provider ratios and access to care. Substance use, so in regards to health behaviors and upstream indicators that might be early signs of suicide, like serious mental illness, depressive episodes, and thoughts. So that's the framework that we use whenever we're approaching a story. We always start with that health outcome and build it out from there. And in the BroadStreet Data Engine, we pulled together sources from many different data sources. We've pulled together data from the National Center for Health Statistics, the Area Health Resource File, the Places data by CDC. We looked at the National Survey for Drug Use and Health, as well as different data sets from the US Census Bureau. So we pulled all of this information together in the hopes that we've assembled it into something that's a little bit easier to use than running to each and every one of these sources individually. So that's really BroadStreet's approach. We have that framework and we bring in indicators to support that framework. And we hope to tell a data story that's empowering to those working to improve community health. And with that, I'll pass it over to Tina for how Franciscan works in the community to make a real world impact.
Thank you, Tracy. We're so excited for a Health Alliance to be rolling out as a campaign about suicide prevention isn't as common as we would think. Our campaign is rolling out actually starting last week, and we're calling it Hope for Another Sunrise. If you work in the field of suicide prevention or you're in the crisis fields, we know how hard it is to get through the night for some people. And we wanted to talk about hope and to give hope and to give love and care. And for this campaign, in conjunction with BroadStreet doing this today, we're rolling out hope, talking about it in more comfortable ways, getting our community talking about it through the variety of classes we offer with QPRs. We do assist, youth mental health first aid. We do safe talk. We have ACEs trainings. We know all these different risk factors and protective factors, but we feel that if we're in the community, getting everyone more comfortable and using the same lingo, hopefully we're developing more empathy and giving people hope that they're not alone. At the same time, we're trying to bring awareness and recognition that of 988 and that it is out and live, and everyone doesn't have to remember the other crisis line number if they can't, that everyone can get to 988. From the reason we developed this was our needs that we did from community health needs assessment. Across system-wide, we consistently receive feedback that our communities were hurting. They were hurting before COVID, and they were definitely hurting now after COVID, or even in the midst of where it is. We were looking how to support them and to address the needs, because we know that all risk factors can lead towards suicide. If you have enough risk factors, we have to build double protective factors. And we wanted to address that because we care. It's not just a health system. We are out in the community, as Tracy was talking about. We're teaching in our communities with our suicide prevention classes. We are talking about physical activity and nutrition, or access to care, access to good food. It all builds in, right, to mental health and disparities. So we're so excited to be with Franciscan and be with BroadStreet today, and we hope you enjoy the story. It is a lot of data, and I know Tracy's really excited for it. I'm just excited. It's so pretty, and it's about hope, and the end of it is about resources. I know y'all on the call are doing good work, and I can't wait to hear what you're doing and what's working in your communities and how we can do some more cross collaboration. So thank you, and I hope you'll enjoy it.
Awesome. Thank you so much, Tina. As you can see, BroadStreet and the data is only a part of what Franciscan is doing. Even in this month alone, Franciscan is doing a lot of work in the community. Data and what we're presenting today is only a small slice of that. So definitely, Franciscan has many, many initiatives going on. As Tina mentioned, the Preventing Suicide story has a lot of information in it, data included. And yes, I'm very excited about the data. And we try to wrap the data around, we try to have the data be wrapped around by background information, how we're framing it, and a bit of background on the topic for those that are newer to the topic. We do have our indicators, our data indicators like percents and trends. And we also have many resources, and a huge thank you to Tina and to the team for finding evidence-based solutions and promising practices so we can find opportunities for prevention. We also have a really extensive citation and reference list. I mentioned this here because I do think that it's really filled with a lot of really nice websites and really a lot of cool resources. In and of itself, the citations and references is a great list of resources. Well, now that you've heard a little bit about BroadStreet and Franciscan, that brings us to part two, the tour on BroadStreet. So with this tour, I'm going to stop the presentation and shift gears. All right, so the way that I'm going to do this with a tour of the BroadStreet stories, I'm actually going to start with the finished story, and then we're going to show you how to step by step add it to your own site. I'm going to come back on video now just so you can see my face, but the other presenters will probably stay off of video. All right, so again, if you have any questions during this at any time, feel free to put them in the Q&A chat. All right, so we're going to do this cooking show style, which means that we're going to show the finished story first. So here we have the finished story in regards to preventing suicide. And you can tell that it is written a lot like a story. So starting at the top and working our way down, you can see that the name is Hope for Another Sunrise, which is a nod to the Franciscan campaign. And we do have an emotional impact warning at the beginning with information about that 999 suicide and crisis lifeline right at the start. If you want to know a little bit more about Tina Hoffmann and some of Tina's hobbies, there's a really great bio section here. And just as Tina mentioned, we do frame this as a story of hope, and we say so in the message from our authors. Preventing suicide. We present suicide as a global health challenge. For those of you working in the field, none of this overview is going to come as too much of a surprise, but the story itself was really written to give solid background for those that are newer to the field. Firearms does remain the most common method of suicide, so right away you can see that we present the central indicator. We have a 7-year average in our community compared to other communities, and I'm realizing you're probably wondering how to run a story like this yourself. So I'll do a little bit of a walkthrough and then I'll show you how to run this story. So pausing a little bit here, I'll go a little bit more into the cards in the deep dive, but all of these cards are interactive and they represent an interactive part of the story. All right, this is for Detroit, Michigan, but I'll show you in just a little bit how to run it for yourself. All right, suicide methods. Majority of suicides involve firearms. Suicide affects all genders, is a leading cause of death in many age categories. And this is where we present the framing that community plays an important role. Within BroadStreet, we want to give people that are possibly writing grants a little bit of some maps to use for framing their community. So what the population is and some basics of where most people in the service area will be coming from, as well as whether or not people are living in the city or in rural communities. Regarding who is dying, we do look at differences in overall deaths from suicide by sex or gender, at least in here in Detroit, a majority male, and we look at the different age categories as well. We have this age distribution chart just for reference. Some cities and places have very, very different age distributions, and so that gives a little bit of demographic context. Because preventions and efforts around youth suicide may require its own set of data, we did pull out youth suicide as its own topic. So here we look at deaths from suicide in youth. So we define youths here as under 20 years old. And we look at the number of people that are under the age of 20 in our community and those with at least one major depressive episode, those who are feeling from the survey that they've had at least one major depressive episode are included here. And then idle and disconnected youth, that means not in school and not working. Teens that have self-reported substance use disorders. And this is a bit of a demographic over where are the youths under 20 years old, where are they located? All right, so this is where we shift gears to talk a little bit about some youth demographics and differences in gender for youth, particularly those who have considered attempting suicide or have attempted suicide. There are very large gender differences in considering suicide and also attempting suicide in both males and females, and those differences might vary based on age. So this one pulls out youth respondents. And here we talk about risk factors in youth. Later on, we'll talk about protective factors for everyone. All right, here for adult suicide, we go into data by adults. And here again, we show those early warning signs like frequent mental distress, serious mental illness in the past year, at least one major depressive episode, excessive drinking, substance use, and unemployment rates in that region. Here we show risk factors in adults. They are unique and separate from those in youth, so we've listed them separately. And then we shift gears to protective factors and messages of hope and 7 strategies to prevent suicide as reported by the CDC. These are the categories such as strengthening economic supports, creating protective environments, promoting connectedness, and strengthening access to and delivery of suicide care, just to name a few. Here we go into one of those, which is the access to suicide care. So here we talk about whether or not people have received mental health services in the past year, whether or not people have health insurance, obviously an important protective factor, and the ratio of primary care providers and mental health providers. You can see them here. All right, for those that are trying to find a HRSA listed health center, there is a link here to an external view. And we have coping and problem solving skills. This is where we get into our resources. So learning more about suicide with overview and sort of some basics for those that are getting to know the topic, and also some useful resources that are specific for after an attempt, if somebody's talking to loved ones, and also general resources and community specific resources as well. So each and every one of these is a link that leads to these resources. And evidence-based and promising interventions are listed here. That brings us to the wrap up where we talk about Brenna and Sofia and the authors. I also want to give a shout out to the artist, Anastasia. This watercolor artist is living in Ukraine currently, and we felt very fortunate that we could use some of the watercolors. And if you're interested in Anastasia's work, we do link to it. And of course, the partnership. So as I mentioned, the reference section in and of itself is a huge list of resources as well. We really do hope that through these resources and through the data itself, you're able to find some important information that can be used in your work. All right, as promised, I did say that I'd show each and every one of you how to run a report like this yourself, because many of you are newer to BroadStreet. Let me just start with how to access this in the first place. So if the story is already written, you can see here that it is shareable. So I can share the link with each and every one of you. And I can also share the different cards as well. But if you want to run a story for your region, and maybe the message for Detroit needs to be a little bit more specific to you, let's look at how to do that. I'm just going to scroll up. Apologies for the vertigo. Woohoo. All right. So if you're logging into BroadStreet for the very first time, I'm just going to start here. BroadStreet.io is the place where you go into the BroadStreet Data Co-op. So the BroadStreet Data Co-op is located here on BroadStreet.io. And if I were to log in, I'm going to show you what it's going to look like for someone who doesn't yet have a membership. Okay, so when I sign in, I'm met by a little bot here. I'm going to activate my membership. So when we have memberships, so this is one of the situations where we have coupons and we also have the ability to share sponsor codes. But I will say that activating a membership is needed because it's a co-op. We rely on everyone contributing what they can in order to support the data and to continue the work into the future. So please talk to us if you need help with any of the coupons. I will say that without a coupon, it's around $300 a year. And please talk to us as we have very, very awesome coupons because we really want to be sure everyone has access to the best data possible. So I'm starting with that. If you are affiliated with Franciscan, then you should be able to get right in. And this is what you'll see when you first arrive. All right, so this is the home screen of the BroadStreet Data Cooperative. You can see right away that the entire story is built on cards. So these cards are specific to me up here. These are my favorite ones. And also there's templates that are available to everyone. And one of the reasons why, of course, we love working with Franciscan so much is that every time Franciscan sponsors a story like adverse childhood experiences, preventing violence and infant mortality, they make this data available to all communities. We have about 10,000 members across the US. So the BroadStreet Data Cooperative is home to about 10,000 members. And whenever Franciscan runs a story for their region or looks at data for their region, they then roll it out to make sure it's available to everyone, becoming good stewards of resources and ensuring that everything is shared. So that's the spirit of the cooperative, and we really thank Franciscan for that. Before I click the obvious button here, which is running a suicide prevention story, I want to just orient you to the other aspects of the site. So here, if I click up here, you can see, I can see my information. And over here on the left-hand navigation, any areas that I create become saved areas. So if I'm maybe managing 12 different service areas, those would be available here under my saved areas. So these are areas that I've created over time and are all collected, and the map will load in just a moment. Here it is. So 5 different service areas, they're all saved here. If I find that any cards are my favorites, then they're added here. And any stories that I create over time are all available here. So BroadStreet saves all of the different areas, favorites, and stories of their members. As you can see, I've run a lot of those, and there's also maps as well. So one thing that BroadStreet has is a map room. I'll go into the map room in just a little bit. If you ever have any questions, the data dictionary is a really great resource. So you can see here, all of the different indicators that we have are listed here. And if you have information, want some more information about them there, you can click on the information and you can see the different geographies. If I was to click map, it would take me to the map room. I don't want to do that right now. I'm going to go back home here. If you have a question at any time, we do have a manned question bot. I won't click on it right now, otherwise it'll open and ask us if we have a question. But if you have a question at any time, you can click it here or here in the upper corner. And during business hours, there is a person, Sofia, who's managing that. So if you have questions and you don't want to necessarily chat with somebody, we do also have a learning center. And there's the bot there. All right, so there's hopefully lots of resources, and let's go and see back to the home screen. So here you can see that there's some options like creating a story. These are the story cards here. You can also go to the map room. So by the map room, this is what I mean. At any time, all of the data that's within our data engine that you see in the stories is also in the map room, and you can layer it and add different layers, and you can change the color and customize it how you'd like. So if one of the cards, for instance, is like, oh, I think we're missing something where I'd really like to see air pollution combined with other indicators, then you can come to the map room and then even save and share that particular map. So the map room is a really great resource for those that say they're data people and really love exploring data, layering them and exploring. The map room is a great tool. For those that are newer to data or even kind of heading to a meeting in a hurry, we do really love the story feature. So creating a new story. These are what we call data stories. So here, the moment we click on a data story, we can see that I have the option of using one of the saved areas that I've showed you before that I have saved, or starting a new area. And let's do that. So within BroadStreet, there is an area selector where you can either select an area from a list of zip codes, a list of counties, or a list of cities, villages, and towns. I'm going to do a list of counties. The counties don't have to be contiguous. They can really be anywhere. Do 2 counties here. I could keep going. I could do all the counties in Wisconsin if I wanted to. All right, so that's my 2 county area. I'm going to generate it. The reason why we generate it is because BroadStreet pulls in hundreds of indicators, some of which use different geographies. So in the cases where a geography might be pulled in that uses zip codes, we just want to have this backup geography here. But wherever possible, we use this main geography here in blue. And that's most of the data. All right, so now to generate the report, all I have to do is click save. And what that'll do is it'll send a message to the BroadStreet data engine, and boom, it creates a story. So all of the story that you just saw for Detroit is now available for this 2 county region. What you're seeing behind you is the data editor, the story editor. I'll talk about that in just a little bit. First, I really want to view the finished story. So here it looks very similar to the one that we started with. Tina's still there along with the bio, and you can see that all the information is there. Where it's different is now this is for a 2 county area, not for Detroit. Now all of the data is specific for that 2 county region. And if this was information that I wanted to share with others, I can use a little bit of a deeper view or a little bit of a zoomed in view of this card, and then I can share it. I can save it to maybe another story that I might have. I can copy the link and just share it, straight with other people. I can also download it if I want this image for a presentation. You can also share it directly to Twitter if you wanted to do an informational campaign. I won't do that right now, but I'll show you what that looks like. So you can post it directly to Twitter. It's a really good way to kind of flood Twitter with lots of good information, and sharing good information is what it's all about. All right, so now it's for a 2 county area. You got a glimpse before of that story editor. Any story that I make, I can edit. So right away, if I have an image, for instance, that I'd rather put here, you can always change the image and upload a new one. If you have a picture of your community, for instance, if I wanted to customize this, if I was going into a presentation and I wanted to brand it for a particular organization, you can also do that by changing the layout and the look. You can change the hyperlink color. You can make sure that it's your logo that appears at the top. We're absolutely okay if you want to brand it to make it professional for you. And you can even share the different link. You can even decide where the logo links to. So there's lots of different branding opportunities. So you can use it for presentations if you're sitting around the table with key stakeholders or those who are allocating resources. Feel free to brand it so it's your own. You can change all of the different sections. If you see a section where you're like, oh, this doesn't make sense in the context that I'm using, you can actually always delete the section as well. So one of the things we encourage here at BroadStreet is for all of the groups and the communities that are running these stories to really make it your own. And then once I save that, I'm going to save it. And all of the changes with a bit of a refresh are available here right away. All right, so you can see that the changes are instant. So this is a really commonly used tool for people that are walking into meetings and they really want to be sure that people are on the same page and we're sharing data, and we're really happy when key stakeholders come together in that way. So those are some basics around the Preventing Suicide story. We've learned about how Franciscan and BroadStreet came together to create the story. We've gone over how we framed the story before we building it out. And then the tour hopefully showed you how to get started on BroadStreet, as well as how to run a custom report for your region. Please definitely reach out to us if you have any questions on how to get started. You can use the email that's associated with this webinar announcement. And this is how you would reach out to us. All right. I will pause there for questions. So we'll continue answering questions. For those of you who have all of your questions answered and you have to head to your next event, thank you so much for joining us today. Thank you to Tina and to Brenna and Sofia. We'll stick around and help answer questions and share resources. All right, so some great questions here. And thank you for those that asked them. Everybody, some people saying hi. Hi, it's great to see you. Thank you so much for your message. It's good to see everybody. All right, so some really great questions coming in. So Brenda asks, is there data available for all states? Yes, in most cases. So in some places, in some rural counties, for instance, data are sparse. So one of the really cool things about working with Franciscan is that when we pull in data, we definitely try to pull in data that has good coverage throughout the US. And so data should be available in most states. For individual counties, it does depend on whether or not there's enough data to report. If numbers are low, it might be a missing data report there. All right, thanks, Robert. Okay, great question about data and race and ethnicity. So we do, whenever possible, try to look at different disparities of data and gender and also age. And in this particular instance, we did not separate it out by ethnicity. And partially the reason is because numbers were quite low. And so the data became unavailable at those smaller cuts of the data. So we do provide data on overall racial and ethnic disparities at the nation and the national level, but within the community level, there's no data cards that specifically split it out. Thank you so much for that question. All right, so a great question about using, what do we use for data processing? So BroadStreet itself is a custom platform that was built in collaboration with members of the cooperative. Franciscan themselves were a founding member of the data cooperative. So we use a custom software platform. We use data visualization called D3. Everything that you see is really geared towards helping to empower those working in their community. So it's a custom platform. We don't use any third party. We use the BroadStreet in-house platform. Thank you so much for that great question. All right, thank you so much. We do hope it's a simple interface. Our goal is to get that 7% of people that don't like data using BroadStreet and hopefully being able to empower themselves with data, even if they themselves are not data people or identify as data people. All right, so we have some questions around kind of how to get started with memberships. Yes, please feel free to email us. We are at the ready for that. When we send around the recording and the webinar recording, we'll share coupon codes at that time, as well as some information of how to enter those in. But you can ask at any time. If you are interested in sort of a lot of people at your organization having it, then definitely please talk to us, because that would be amazing and we'd love to work with you on that. All right, some questions came in. Thank you for the info. I'm hoping I can use BroadStreet to gather data that will help us for applying grants. Oh, yeah. So great question from Bonnie about grants. BroadStreet is really, really commonly used for grant writing. As you know, for grants, you have to make the case, you have to show that resources are needed, and BroadStreet is a great tool for that. It automatically compares your region against benchmarks or alongside of benchmarks, and can really help you make the case. And you can use the graphics. So please feel free to use the graphics, to export them, to use them in your presentations or your grant. So please do use BroadStreet for grants. We understand that those places that are often most in need have the fewest access to good data resources. And obviously that's one of the founding motivations of BroadStreet. So, and yeah, thank you so much for joining us. We hope to see you on BroadStreet.